RocHackHealth was about hacking healthcare data. One of the challenges was to try and predict hospital readmissions, whether people who were discharged from the hospital and went home after being ill would come back to the hospital. And obviously, when you go home, you want to stay home. So we had the groups work on a data set to try and predict who might come back. And the ultimate goal is to take some of these methods and to implement them here at the University of Rochester and translate those into ways of spotting patients that might be at high risk of coming back to the hospital and intervening to try and change that. The second competition was looking at prescribing patterns of controlled substances, things like sedatives and narcotics. There is a problem with over-prescribing these medications in some individuals, prescribing way more than is normal. So we used a publicly available data set that's put out by Medicare, and the team that won, it turns out, identified a number of individuals who had actually been investigated for overprescribing, and some of whom actually went to prison. The last competition was to essentially create a social network of how medical providers are linked to each other by the patients that they share. We ultimately hope to use that kind of mapping to look for groups of providers that do an outstanding job of taking care of people with certain medical conditions, and then to go in and ask, what are they doing? All three of the groups showed real creativity and promise, and we are hopeful that within a year that we will be able to go into much more depth and apply these methods to more complex and real-world data sets here at the University of Rochester Medical Center. And our goal is to improve patient care and improve the health of our community using these methods.